So now let's talk about our dental plans. And here at Butte County, we actually have 2 dental plans that are offered. They're both from Delta Dental. Many of you may be associated with them before. They are both considered PPO plans. That means they both have networks that they work with. The first plan is the preferred provider option, which is referred to as PPO on your paperwork. But when you see the deduction code for this plan, it will say DPO dental plan. And the other plan is the PPO Premier plan. So what are the differences? Everybody wants to know. Well, actually, out of our benefits, I would say this is the most complicated piece of our benefits. First of all, let's talk about the Delta Dental Premier plan. The Premier plan allows you to go to basically any provider that you wish. Under the Premier plan, there's really, though, 3 different networks and 3 different pricing structures under the Premier plan in order to allow you to go to whatever dentist that you would like. Under the Premier plan, the benefit, the highest maximum benefit that you can get is $1,100 per person per year. And to have that benefit available to you, you need to use dentists that are in the other network, the PPO network, which doesn't make sense, I know. They also have the Premier network, which gives you the benefit of $1,000 per person per year. They pay 80% of basic and preventive care and 50% of your more expensive benefits and $1,000 maximum lifetime benefit on orthodontics. That's under the Premier plan. On the right-hand side of your folder, you'll have flyers. They're either pink and gold or they look like this, and they describe what each of the plan's benefits are. The other plan is referred to as Delta Dental PPO, and the benefit maximum for that plan is $1,500 per person per year, calendar year, and they pay 100% of basic and preventive care, 60% towards crowns, and if you have children that are going to be needing orthodontics, they pay $1,500 lifetime benefit under that plan. That plan there, though, is network driven. So if you don't stay in the network for that PPO plan on the right-hand side, your benefit is reduced to 50%, and they only pay up to $500. So you will need to investigate what the network looks like in your area and what dentists you want to utilize. If you're a person who's been going to the same dentist since you were a little girl and you're afraid of dentists, you don't want to go to anyone else, it may be that you're looking at the Premier plan because that'll cover anybody, versus the Delta Dental PPO plan, which you get a much higher dollar benefit. It's even less expensive. But you have to stay in the network or it really didn't do you much good to go with that plan. With that also, I would recommend that if you're having any major work done, anything over $300, I would recommend having the dentist send in an estimate to Delta Dental to get an authorization to make sure that none of the services he's providing are something that you may have a little bit of a waiting period for. Yes.
I have a question about the orthodontic, the 80%
Yes.
with a lifetime maximum.
Right. So they pay 80% of orthodontic services up to $1,000 total out of pocket for them, and then they cut you off
So
for
that's
orthodontics.
Not
Yeah.
80%.
Well, it's 80% up to that $1,000 out of the insurance company's pocket.
Right. Okay.
Yeah. We have talked to the benefit committee saying that we would really love to see a more difference in the plan, maybe a very low plan and a very high plan, because really $1,100 isn't that much for dental coverage if you have a family per person per year. So we would like to see for the individuals that have high utilization for dental work to have a richer plan, and then to have maybe a lesser plan for people that maybe don't utilize dental work very much. But that's something, again, that's a benefit that is bargained for in negotiation. So you might mention that to your bargaining unit as you go on. Many individuals will say, well, I want the better plan. Which one's the better plan? It really is in the eyes of the beholder. Do you want more as far as dollar-wise, or do you want to be able to go to who you want to? In the smaller towns, it's actually a little bit easier to stick with the Delta Dental PPO plan, because the smaller town dentists don't have quite as much overhead and they're more willing to negotiate within that network. Whereas in Chico, it's a little bit harder because the overhead is a little bit higher and the dentists in that area are not as willing to negotiate. So it may be the network that's available in Chico. If you're wanting to have your dentist in Chico, maybe like Western Dental or Access Dental or something to that effect. But still, you're going to get a good, rich dollar amount benefit. That's just something you'll have to weigh out. Is there any other questions about dental?
Yes.
Yes.
For the PPO plan, it says that deductibles are waived for D and P. What does D and P stand for?
Let me take a look at what you're referring to. Domestic part, DP is domestic partner.
Okay.
Yes, yes, you're right. Diagnostic and preventive. I wasn't quite sure where you were looking.
Oh, okay.
Yeah, so I'm like, oh. Okay. Again, at open enrollment, that's your opportunity to change dental plans. If you do try one dental plan and it doesn't quite work out for you, you can change your dental plan at open enrollment and have an opportunity to get into a plan that would better serve your needs. So also in our health benefits package, we have vision coverage, which is offered to us through the VSP company, which is Vision Service Plan. It allows you to have an exam every 12 months. You can also purchase new lenses every 12 months. Under the plan, you'll get new lenses. And you can get they'll give you a $130 allowance towards new frames every 24 months. So, and that's all using their in-network providers. That's where you get the best benefit for it. But we have found that many employees find it beneficial to maybe use a VSP provider for the eye exam and then go to Costco and have them waive what the allowance amount's going to be. They bill VSP for the allowance amount, or they may have you. There's kind of been, some Costco's do it, some don't. But you could still save quite a bit of money there because you're going to be responsible on the frame for anything over $130, and your money would go a lot farther maybe using Costco in that situation. On the right-hand side of your folder, I've included a benefit summary with some girls with sunflowers, as well as a brochure with the network that's provided for you in the area. So you shouldn't have any problems finding providers for a vision service plan. Okay, so that is, if there's no more questions about the health benefits package, the health, dental, and vision will go on from there.